If you're looking down here at the model that we're going to be working on today, the first thing that I tell assistants is I want them to really look at the prep. I think that a lot of times when any type of provisional restoration is fabricated, they're not really looking at the teeth themselves. And this is really what's going to decide as far as the sizes that we're going to use. With the Protemp Crown, there's a small and a large. So it makes it really easy for the assistant or the dentist to really choose what are they going to use. It's very entry level. So, and of course it's going to be a molar, but one of the things I want them to look at is I always start with the small first. If I've got a larger crown that I'm going to be using, I really want to make sure that this tooth is a lot bigger in size. So again, we're going to analyze the prep first, make sure that there's no debris in approximately here, so I want to make sure that I don't have any dust, or tooth dust we should say, in between before we start making our restoration here, our provisional restoration. So, got that first. The next thing I'm going to do is I'm going to look at this ruler, and I'll tell you in my practice I really don't use this ruler, but I would suggest that for an dental assistant that's starting out making these, or even a dentist, we want to look at exactly how much space we have or the size. And in this case I'll kind of angle it here for the camera just so you can see. I want to look at the distance between the tooth behind our prep and a tooth in front, okay? So, but once you start making these, I think after the first two that I made, I was like, I really don't need this ruler anymore. But I think it's good just to kind of get an idea of the size to start with. So, next thing we're going to do is I've got my little package here, and I've already opened it up. If you just kind of take the corner and just open it up, it actually comes this little sealed container here, and this is really how it looks. And the first thing I want you to know is that you don't want to just arbitrarily grab this and push it through. I want assistants to understand that this is really just made out of composite, so you really can take it and crush it in your hands if you're not careful. So we easily and gently want to just push the crown actually through this little plastic piece here. Because remember, I can actually distort this in my hand, so I'm going to put that to the side. But one of the things that 3M has done is they've made it really easy, and we say, if you look at the crown here, as I'm doing, I'm going to try to make sure the camera can get that. I want to look at exactly where the crease is, and we used to say cheek to cheek, and that's kind of one of the things that we always recommend is you want to see this little, I always say a little slit here. It's almost like butts on a bar stool, we'd hate to say, but that's really basically what it is. If you turn it to the inside, there isn't really a little line here. So it really makes it easy for an assistant that's not certified to know, okay, cheek, and it's actually going to go to the tongue or the cheek side, not the tongue side. So if I'm looking at how that would sit on this area, it basically would sit just like that, okay? The other thing is that when I'm looking at the tooth, I want to make sure that I don't just grab it and just push it on here. I want to make sure that I'm going to sit it on top like that. And I'm also going to look at